basically some of these, these niche issues.
It's also a question of how what we're doing fits into what CBPR is about and the principles of CBPR, I think, and we struggle with that as we've talked about. I mean, in the police department survey.
And the Pew Charitable Trust. Often because they're more flexible and have more of a, well, I think it could be argued, but have a little bit of a social justice mission, perhaps, or a social justice arm of their mission. But then I also just wanted to talk through some of these ethical issues, or at least raise them, and we've talked about some of them, but can the idea for research be generated first from outside the community? Because that's often what happens, but it's not really reflected in the principles. So these are not questions that we can necessarily answer today, but I think are good to think about. How do we deal with historical trauma in terms of research and just outsiders with privilege doing stuff in communities? Who's compensated for their time? Like who's spending all of that time where they're not getting compensated working on the partnership and who isn't? We talked about the funding streams coming from the university, institutionalized racism in terms of, well, really at all factors of the partnership and of the work. Who defines the community is also a really important one. We talk a lot, especially at the beginning of CBPR, a lot of work in community-based participatory research was geographical communities. So, this neighborhood in Detroit or this section of Seattle. But more and more people have been doing CBPR work with communities of identity. So I've done some work with South Asian communities in Michigan, or you can do work with the LGBT community. And does that change certain parts of the principles or how they're enacted? What counts as participation? Which I'm sure we could have a very lengthy discussion about. And then I think one of the critiques that's often leveled at CBPR is that it's not good science. So is it good science? What makes good science? If we're talking about interpretivist work or meaning making, does that change our conception of what is good science and what counts? And how do we intersect with people in the university who may or may not be aware of this whole branch of research, epistemology, et cetera. And then differences in emphasis regarding level of change. So I just was talking about kind of making that policy change. Often I think a lot of, at least in public health, which is where I'm situated right now, the medical model really focuses on individual level change. So how do we make it kind of an ecological approach? And how do we get people on board with doing that? And then, where are we on this continuum, and ideologically and in practice? Because I think it's possible that in our center, we're on all parts of the continuum for different projects. Or do we want to have kind of one overarching approach that we're using, like the memorandum I was talking about earlier? So these are the last kind of questions I have. Where does the center fit with regard to CBPR? Are there elements of our projects that incorporate CBPR principles? Are there other ways we should use the CBPR approach in our research in terms of steering committees, advisory boards, and to what extent should each of our projects have memorandums of agreement or understanding? So I don't know if people have thoughts on these last questions. I mean, Carlos talked about some of them for the distracted driving.
Well, one of the other ones is sort of the conversation we've been having with the police department, which has to do with who's going to own the data if we come up with the money to fund the project. Does it belong to us or does it belong to them? If they come up with the money and we split the money or this funding, then how does this sort of get operationalized? And so the presentation of the MOU really becomes quite significant and could, at some point or another, stall basically the whole conversation about going forward if there can't be an agreement or if there is this impasse regarding whose data is it, basically. And so we've been trying to figure out a way of how to address that issue. it's really taken a back seat at this point, to the point where we're trying to generate funding, to get funding first. And then I think we said, well, we'll just, have this very brief conversation about who owns it, without really giving some thought. I shouldn't say that we haven't really given thought, I'm not saying that at all. I think that what you presented about those MOUs is very critical, it's going to be very critical, because it's really going to sort of define congruence between the needs and the goals and the partnerships between.
Especially when grant funding is involved. So
Exactly.
often, so if the grant has to come first, which sometimes it does, usually it does, it completely disrupts
Yeah.
the principles that we were just talking about, because you usually have to propose some sort of research, which means you've determined what the, you've determined what the question is, you've determined what the sample is, you've determined a lot of things, and you can use your time prior to that trying to build relationships and coming up with that or getting some buy-in, but it's not going to be as extensive as it should be. And often what people end up doing is kind of getting partners to sign on and say, if we get this funding, let's do this.
Yeah, well, just to follow up, I'm just thinking right now of the distracted driving. I'm thinking of this sort of as the model, not the model-based way, but I'm trying to test out. This distracted driving initiative has caught a lot of people's attention. And so the grant that we have sort of tells us we have to go in a different direction than the direction that we want to go into.
Yeah.
And so we're sort of driving this, car basically off the cliff in another direction that we want to go into. But now the university is saying, wait a minute, there's a way to sort of, we can rescue this, but there is sort of this contradiction between what they want, what State Farm wants, and what we want. So all of these sort of conflicting factors we're sort of muddling through this in a way of a bumpy road. Hopefully we'll find some way to satisfy, State Farm, which is giving us the funding. The university has something else which sort of has this sort of political aura to it that sort of wants to sort of capture this. And the reconciliation between the districts of what they're sort of willing to give us basically sort of carved out already in the IRB that we have. And we didn't even think about it. I didn't think about this until you were raising this question about sort of this memorandum of understanding with the districts, basically. That may need to be fleshed out as well. It goes beyond the IRB and will ultimately have to go to courts. So this is almost still like a work in progress. Although we have the university's blessing, but we also have to be very careful that they don't sort of try to hijack or co-opt this in a way that sort of is going in a entirely different direction, which is really a challenge, basically.
Right, and I think that's why the role of steering committees or advisory groups is really key, because I think having a really solid community academic partnership that is larger than one particular project can kind of get you through some of these difficult times, but it requires a lot of trust, which is the kind of critical dialogues portion. Because a lot of what CBPR is talking about is that communities, this is communities data, we need to focus on the needs of communities, but there's also this kind of realistic situation of academics being in positions where if they don't publish, they're going to get fired, right? So fired is, nobody says that, but you know what I mean.
Liberated is another word.
Liberated is another word. But this idea of having, being able to have honest dialogues about partially what I need for my job is this, what you need for your community is this, how can we work together is useful. And additionally, I think that's why you write it down and sign it, because then it becomes a situation where people say, okay, we agreed that we are going to write about this, and we agreed that we are going to publish data, even if and this is another issue, like even if the results aren't what people want, which can often happen. I had some stuff in here in terms of federal funding, just if we had time. I want to talk a little bit more about the ethics of all of this at the end. So I'll just go over this quickly, but just NIEHS was the first federal agency to fund CBPR specifically, so environmental health stuff in terms of asthma. And then the Centers for Disease Control and Prevention are another really good resource for CBPR funding. They now have a bunch of prevention research, have funded a bunch of prevention research centers across the country, which are trying to do, the funding is trying to do some of this institutional work, which is trying to fund the apparatus so that people can do the projects, if that makes sense. The National Cancer Institute has done a lot of work with American Indians and Alaska Natives, funding CBPR projects with them, and the U.S. Office of Disease Prevention and Health Promotion also. And then I also mentioned, I think foundation funding can be really helpful sometimes for CBPR. So these are a few that are really into CBPR funding. So the Kellogg Foundation, the Kaiser Family Foundation, the Robert Wood Johnson Foundation for Environmental Justice, the Detroit Hispanic Development Corporation, and Warren's Corridor Development Coalition. They're working together to reduce asthma. I just want to, it's a little bit differently organized, I just want to show you. So they have the principles again, and they all agreed to them. Then they have specific program objectives so that everybody's clear on what the specific aims and objectives of the research are. And then it talks about each responsibility of each group, right? So responsibilities of the University of Michigan, how they're supporting the partnership, how they are, so for example, collect data, conduct preliminary analyses of new and existing data, and provide feedback to all programs. So here it says, okay, they're collecting the data, right? They serve as a point of contact with NIEHS, which is the funding agency, and that's because all of this, their money happens to be going to the University of Michigan and then getting distributed. So again, here we see, it says, so here it says provide a 10% staff person's time to serve as the host agency liaison, right? So I'm just showing it's very detailed, right? And everybody agrees to it. And I just wanted to show you here, at the end, it talks about financial arrangements, and it shows how much money is being requested, how much money is getting given to each organization, and when, and for what kind of work. Okay. Okay, so when we talk about possible challenges in implementing CBPR, there's a lot of them. There are things related to time, resources, lack of congruence between needs and goals of partner organizations, the university requirements, grant requirements. So I wanted to kind of throw it out to you when you see all this. What do you think might be challenges in your work that you're thinking of doing in terms of CBPR?
I would say the resources.
Mm-hmm. How so?
If funding is required, where will it come from? Where will I be able to get a grant or grants in order to accomplish it? How difficult will it be? That's
So securing grant money initially, and then also, because I've experienced this, right? Even after you have a really good grant, then you sustainability becomes a major problem if it is grant funded.
exactly.
One of the things I think, in terms of setting it up, that can be helpful is if organizations somehow buy into it on some level to have some sort of percentage of someone's time to be related to the steering committee to move people through that time of sustainability. But I think probably funding is the main roadblock to all of this. So I think
Well, what do you do if the community says, or if you're working with a particular community group and they say that we don't have funding, we don't have any money, we
Right.
don't have any money, we need you to help us find the money. That's
Right.
what I'm thinking.
And often that's what happens. I mean, I think that in general with CBPR partnerships, a lot of what the university brings, in addition to possibly some, as you were saying, sort of technical assistance in terms of data collection and analysis, is funding. Because there are some funding streams, but usually they go to the university, right? And then the organizations end up being subcontracts. And that's okay, except immediately that sets up some sort of hierarchy between who has the money and who is asking for the subcontract from the agency. But I think it is a major stumbling block, for sure.
Well,
Yeah.
All these 5 issues basically, time to do this because, to undertake, at least my experience is, community-based participatory takes a lot of time and investment,
Yes.
basically to sort of even begin to nurture relationships. And our tendency is not to spend too much time sort of cultivating, these relationships, because we just want it done and we want it done quickly. And so as a result of that, sort of the time factor, I think, sort of gets abbreviated, where you really don't sort of have the total buy-in that you need, which is sort of related to the resources. But once sort of this home university, the other components as you put up here, this congruence between the needs is something that's ever changing.
Yeah.
And so it's not something that is sort of, carved in stone, as you were just alluding to before. When you take a look at, smoking cessation, then it turns out to be something entirely different, and then before you know it, you have all these spin-offs that sort of, you have to try to reconcile them to bring back the
The community's welfare. The project is designed to increase community knowledge of the issue. Community and academic participants will be involved in all project phases, including planning, implementation, research and evaluation, analysis, interpretation, and dissemination. And it talks about how that happens in A, B, C, all the way through F. As an example, at the end, community participants will be partnered with academic participants in analytic issues, including interpretation, synthesis, and verification of conclusions. So they talk about how this is going to work. And then it says the project may consider the political, social, and economic determinants of the main health issue. And it has 5, which is blank because it's a draft. We'll ignore that. And then it talks about dissemination. What I think is interesting too is to look under rights, conflicts, and responsibilities. So it says, acknowledging that conflicts in partnership most commonly arise over financial matters, credit for work, and responsibility and opportunities for publication and dissemination, the following sections present principles and models for handling those issues. So it's very clearly defined how you're going to work out issues related to finance, related to authorship, and such. So financial arrangements, each partnership agency contributes to the project, at least in part through in-kind contributions, particularly in development phases. In the other one I'll show you, there's an even more explicit financial piece about how much each person is getting and who the fiduciary is and all that. But I think also their authorship is good here. So this is a community-based participatory research project in which academic centers and community agencies participate as full partners in all research. That means that project design, data collection, analysis, and interpretation of data, publications and presentations, and other products will be generated with community participation. And then it says, we will follow usual journal guidelines regarding authorship on papers. Authors will be expected to contribute to papers and be responsive to reviewer concerns in a timely manner, i.e. within 2 weeks or as designated by the council. Some papers may have a group of participants acknowledged with a shorter list of authors. Then it says, ordinary journal policy is for the paper's first or senior author to decide on authorship listing order, but the support council will resolve disputes and has the right to review overall fairness. The usual expected policy will be to circulate the product, press release, presentation, abstract to the co-signatories of the agreement for comments. A broader circulation be designated by a majority vote. Then everybody, it says, for data ownership, which is also a major issue in community-based participatory research, is who owns the data. So community members might say, you're collecting data on this community, it's my data, this should be our data. So there has to be a kind of a clear elaboration of what that means. Whose data is it? Where is it located? Are there multiple copies of the data? How does your institutional review board feel about that, right? So, so it'll say, so at the end of the project or at reasonable interim stages, everybody's going to retain a copy of the full data file, de-identified appropriately. Issues of authorship of the data will be regulated by the council, right? So again, you see how important the council is in this case, or the steering committee. In terms of IRB responsibilities, everybody requires that at least one person in each participating community partner have IRB certification, which means in this case that they would go through the city training, for example. And then here for reviews of papers, products, and press releases, there's an even more detailed explanation. So submitted research papers and abstracts will be circulated to the council and to lead participants at partner sites at least 1 week and preferably 2 weeks prior to the submission for review and comment. There will be at least a 5 to 10 day turnaround time for comments to the lead author. While input and full exchange among participating partners encouraged, consistent with the usual scientific policy, partners will not have the right to block submission or enforce changes on scientific papers. Rather, it's expected that the first or senior author will review comments from partners, discuss major differences of opinion, and circulate the final version. If there's still disagreement, that has to be included in the discussion section. Right, so it clarifies that if people, we're not going to necessarily change results based on feedback, but we can talk about how there might be differences of interpretation. Okay, so that I think is everything I want to talk about with that MOU, just to show you that later on, this is where it says project description witness for wellness, and that's one of the smaller CVPR projects that's under this larger umbrella. And it talks about what's actually happening in that project in phase 1, phase 2, and phase 3. I also just wanted to show you this other memorandum of understanding because it's specifically with the University of Michigan School of Public Health, working with a couple of organizations, the Detroiters working on some CVPR stuff. So first they did needs assessment. Collected data, used secondary data, and then they went out in the community members and researchers together, using door-to-door surveys of 1,000 randomly selected households in various precincts. So again, they're making it random, they're trying to make it as stringent a design as possible to get good data. And then HCC members help to create the questionnaire, collect the data, and interpret the findings, like we talked about. And then the surveys revealed high rates of smoking, poor dietary habits, lack of exercise, and low medical utilization rates. So using that data then, they planned their direction. So they presented the data to community members, comparing the rates of those things with the rates, national rates, as well as Healthy People 2000 goals. And they decided to make, and they made a list of the top 5 issues that they were going to work on, which ended up being smoking, exercise, alcohol use, mental health, and dietary choices. Presented those at a community meeting to get feedback. So there was both the people working very hard, doing the questionnaire and collecting the data, but also making it a larger community conversation at various points of the research to make sure people are aware of what's going on and have input. They did focus groups after that and a statewide workshop to interpret the data and gain more community input and make action steps. And so they decided to work on smoking cessation first. They wanted to pass a citywide ordinance to create non-smoking areas in all city buildings. And I want to stop here and say that this is rather than being an individual, you can imagine that if we're working on smoking cessation, a lot of people would be like, let's have some behavior change workshops for people to stop their smoking, right? This is a much more higher level, like systems-wide change, right? Trying to actually change policy, which often can be a CVPR goal, particularly when issues of kind of institutionalized racism are involved and things like that, right? So HCC members created community awareness of the issue. They studied what other communities had done. They mobilized a strong turnout at City Hall, where they presented the survey data and proposed the bill, and then the bill passed. So this is just one example of what they did. Then they went on to keep working, which is also, as Richard was saying, in terms of the 9th principle, having a sustained approach over time is really important. As a community organizer, what I think is also cool about this example is that they went for it's not an easy win, but they went for a fast win early to give people momentum to keep working, right? This was something very defined. They went, they mobilized, they found a lot of people, and they did it. And they said, oh wow, this partnership's working. Maybe now we can address something more difficult, like exercise or alcohol use or whatever. Okay, so that's kind of an example of CVPR in action. I also wanted to give a couple of examples on MOUs, which are memorandums of understanding or agreements. So I'm just going to cut out of the PowerPoint for a second and bring it up. So this is an MOU draft, and I thought you could just look at it briefly. I'm going to kind of highlight some things, because this is what usually an MOU for CVPR looks like. They're very different, but they tend to have some similar qualities. The way this MOU is organized is that at the preamble part, or it's not even the preamble, the first 4 or 5 pages talks about, in general, the Healthy African American Families Community Participatory Research Collaboration. They're like the umbrella organization or group. So they have a set of principles that anyone who works with them agrees to. And then at the back end of the document, you see, okay, this is one particular project that we're working on with the Healthy African American Families group. So you can, that's one way you can organize it, where, let's say, I'm just thinking, if we're thinking about kinds of, you know, what we might want to do down the line with the center, maybe the center itself has some overarching document or memorandum that people agree to, and then as we do different projects, we amend them. It's just a thought. Anyway, so so it kind of, it first says sort of each project may involve different partners in a different scope of work. An agreement for a particular project consists of the following. So it says how you actually agree to a project. Almost all memorandums of understanding for CBPR include these research principles, with the idea being that if everybody signs this, they're really on board about what this means. Now, people say, people write the principles differently depending on what the group decides, but in general, they're very similar to what was presented earlier. So you can see that, it says it seeks to enhance, and then have various steering committees for each CBPR project that they're doing. Very key, I think, after having done a bit of this, to this kind of work is having memorandums of understanding and memorandums of agreement. And we'll talk a little bit about that, but really kind of laying out what the principles are that the partnership is working under, and then how you're actually going to kind of deliver on those principles when things get hard. And so if you the idea is that if you talk through this at the beginning of the partnership as you're convening the entire group and everybody's on board and they sign this, you can kind of go back to that when there are bumps in the road, which there definitely will be when you're trying to do collaborative work. Another, I think, good structure or processes to have is called the Community Action Team, which are actually people from community organizations, members themselves, who are doing a lot of the research themselves on the ground, engaging with community members, because community members know their communities the best. And so the idea is that these community action teams, kind of, if you think of the steering committee as one layer, they might be another layer underneath the steering committee that intersects between the researchers and the community. Co-authorship and co-leadership are very important, and I think this is one place in which some people get stuck sometimes is, some of us know that for an academic career it's really important to have publications, and that is very important for researchers. The question that becomes, if you're really working with these principles, what is in it for community members who are maybe giving data to the researcher, working with that data? So how do we develop real collaborations in terms of co-authorship and co-leadership publications, as well as maybe reports or doing any kind of actionable work? I know that another colleague in SHTM developed this whole conference, right, an academic conference on CBPR, and one of the things she insisted on, although it was not very popular with some of her colleagues, was that in every session that was a keynote, there had to be a community member and there had to be a researcher presenting their work together, and they needed to fund that. So instead of funding, 5 speakers to come as keynotes, they had to fund 10 speakers to come as keynotes. But if you really have a commitment to community-based participatory research, that's the kind of thing that you will do. Provision of food, transportation, childcare is often very important in terms of making sure that people can come to meetings. So meetings are often at night after people have been working and they have childcare responsibilities. So it is often a commitment on top of all the other work they're doing. So it's important to make it as easy for them as possible to engage. Having accessible meeting locations, of course. And then really key, I think, to CBPR is this concept, going back to Freire, of critical dialogue. So it's really, in many communities who have had kind of researchers come in and take data, use the data, write on it, leave, there's a lot of fear and a lot of anger and a lot of historical trauma associated with the research process. And the only way, according to Frary, and I agree as well, to work on that is to actually talk about it critically. So to have people in a room around a table talking about what it means to do research and what the fear is and what can be gained from that from the research process, and making sure, as Richard was saying earlier, if the people who are in the community are defining the issue and deciding how it's going to be researched, that is one way that that critical dialogue can occur and can be helpful. So self-reflection is very important on behalf of the researchers and the community members, as well as having cultural competence to work across difference. So all of these are various structures and processes to facilitate the principles, some of which will be in this example that I'm going to show you, but we can also talk through it. Okay, so the case I'm going to talk about is a partnership for health promotion in Indiana that Meredith Minkler worked on, and she's one of the grandmothers of CBPR. And basically, it was a partnership between 4 faculty members at Indiana University School of Nursing and the Health Cities Committee in Newcastle, Indiana. So at the beginning, there was no preconceived direction of what the group would do. And I think that's really key, as Richard was saying, in terms of the community itself defining the issue. So the only goal was to make a healthy choice make the healthy choice the easy choice. And it was funded by the Kellogg Foundation, and the Kellogg Foundation is often a good place to go for funding.
Cyclical and iterative process. In other words, this isn't a one-shot deal, that it's a process of establishing a partnership with the community, and that partnership will grow and go through cycles of research, and that we have layers of growth here of how we work with the partnership and grow and move forward. Keeping with the whole idea of the partnership and making it a real partnership, CBPR disseminates results to all partners, and involves them in the wider dissemination of the results. So again, this is a partnership, so it's not just the researchers taking the data and going off and analyzing and writing papers. This is everybody analyzing together, everybody coming up with conclusions, everybody disseminating the results, the whole partnership. And CBPR involves a long-term process and commitment to sustainability. So again, kind of opposite of that other view of parachuting in, grabbing your data and running out, right? This is a long-term commitment, it's a partnership. You're there for the community members with them, and you're making a commitment when you get into this. So I said I wanted to just go back to, we talked about it being a collaborative approach that's equitable in all phases of the research. And just to highlight some of those, what are we talking about when we say this being equitable in the various phases of research? So these are some of those areas where the partnership needs to be considered, and how is the partnership going to be worked here? How do we form the partnership in the first place, and how do we maintain the partnership? Amy's going to talk about some of that as we move on here. Procurement of financial resources, working with the community on that, working with the partnership. It's not just the researchers bringing in a grant necessarily. It may be that the community has resources as well for bringing in financial resources to keep the partnership able to do its work. Community assessment. This is partly data gathering, partly thinking about how are we going to approach the community, how are we going to get the information we need about the community through the functioning of the partnership. And definition of the issue. This is probably very key to the idea of action research and community-based research, is we are not coming in and setting the agenda as researchers. The idea is here, let's talk about this together. What are the issues here in this community, and who sets the agenda? What do we want to focus on? What do we want to get answers about? So it all becomes part of the partnership. Documentation and evaluation, and feedback, interpretation, dissemination, application of results. All those various aspects of the research process have to now become collaborative under this model. It's intended to be a partnership all the way through. So again, keeping that, it's the opposite end of the spectrum from that parachuting model. Okay, so that's kind of the overview of the principles and the heart of it. Amy's going to get into how this actually works out in real life.
So, as you might imagine, this is a lot easier said than done. We're both hoping that we have some time at the end to kind of talk through what some of the challenges with really doing this are. To that end, we wanted to talk a little bit about what, over time, as people have been doing CBPR, they have developed various structures, various processes to facilitate enacting these principles in a real way. So I wanted to talk through some of those. We're also going to give an example of how CBPR has been used in the community. And we're hoping then at the end, and I'm also going to show you a sample memorandum of understanding that people have developed. But I'm hoping that we can talk through some of the challenges with this and think through what it means for the center. Okay, so some of the structures to facilitate the principles are having steering committees. So, and by steering committees, it kind of goes back to developing the partnership and maintaining it. So it involves having representatives from various community organizations as well as researchers sitting around a table at regular intervals steering the project. And there are various research centers across the company that only do CBPR, and what they might have is a whole big advisory board, kind of what we have here, but with more community partners.
Social progress is achieved through upheaval of current social power dynamics, challenging oppression. People with less access to power still have privileged knowledge that elites do not have. Who knows the community better? Who knows the way they survive the struggles, what the community is like better than the people who are living there? And then research is a tool to be used by, is a tool that has been used by elites to dominate others in the past. And if research is to be used, it must be used with the explicit goals of changing inequality, of improving situations of inequality. It's not value-free, in other words. It's not just that neutral kind of tool that the Northern tradition has. So there is something of a continuum for how to think about research then along this participatory idea. Unilateral is at the far end. This is traditional research, the researchers coming in, gathering their data, and doing it all themselves, analyzing the data. Collaborative research is more along the lines of the Northern tradition, what Lewin is talking about, of working with a group to be able to make system changes. It's kind of a problem-solving approach. It's very utilitarian. Again, it doesn't have to refer to class issues. It doesn't have to refer to liberation. It doesn't have to refer to improving inequality. It just is about solving problems. And again, this is very often done in businesses and industry just to try to improve efficiency. And the participatory level on the other side of the spectrum, this is more where Ferreri's coming from. This is working together for emancipation, to overcome oppressive situations, using research to create knowledge that can be then used, this is action research, for the sake of helping people to change their situation. You could push it beyond that to think of even a democratic edge to this, where people would just be doing this on their own. The community-based model tends to think of researchers coming in as technical assistants, really, for the process of knowledge building. So there are some basic principles for community-based participatory research that are fairly similar across a variety of authors who write about this. At the heart of community-based research is the idea of community and how important community is. Community is a unit of identity. By that, we're talking about units of identity like family is a unit of identity and neighborhoods are units of identity. So are communities. They are subjective units of identity. People understand themselves as being a part of a community or not being a part of a community. And the focus on community is on the community's strengths and resources. How can we build on those? CBPR facilitates a collaborative, equitable partnership. Partnership is key with this between researchers and community members, involving an empowering and power-sharing process that attends to social inequalities. I want to come back to that one in a bit in the next slide, just to pull out some of the pieces of the research process. So CBPR fosters co-learning, and a capacity building among partners. That's the idea of increasing their ability to do this on their own as well, to create their own ability to conduct research and build knowledge. CBPR integrates and achieves a balance between knowledge generation and intervention for the mutual benefit of all the partners. So this is action research. It's not just creating knowledge. It's knowledge along with intervention so that we can make changes. It focuses on the local relevance of public health problems and on the ecological perspectives that attend to multiple determinants of health. Now this sort of pulls health out here. A lot of the work that's been done in this area has been in the area of health. It's been in the area of health disparities, health literacy, those kinds of things. So this focuses particularly on health issues, but it takes an ecological perspective, not just focusing on particular pathologies, but on the whole ecology of the situation. CBPR involves systems development that uses a base to it, and it wasn't necessarily something that was meant for social change. It could be systems change, but not necessarily great social change. It wasn't so concerned, say, about class issues or oppression. And it could be fairly conservative. This is big in organizational theory of trying to work with people in factories, say, to get their input on what's the best thing to do and then make changes around that. So some of the assumptions of the Northern tradition are social progress can be achieved when knowledge is co-produced by researchers and participants. And their research is basically kind of neutral. It's just a tool to be used, a series of methods for gaining information, and then we make our decisions about changes to be made, wherever that would be. But moving on to the Southern tradition, we have a kind of a different flavor altogether. The Southern tradition grew up really in the midst of people struggling with tremendous oppression and poverty, primarily in South America to begin with. One of the leading theorists in this area is Paulo Freire, who wrote in Sao Paulo, Brazil. He was an educational theorist, and he worked really trying to teach very poor people how to read and write, and developed a lot of his educational theories through that. It comes from a Marxist perspective, and participatory research is seen as a tool of liberation of oppressed people. The idea is to develop a critical consciousness through the process of conducting research together as a community, creating our own knowledge, helping people to create their own knowledge so that they can use that to challenge oppressive structures and the knowledge base of elite factions. So one of the, I think, important things and distinctions that Freire makes here with that I think is important for research and for us thinking about conducting research is the difference between what he calls cultural invasion and, I'm going to jump here, cultural synthesis. Cultural invasion, he has this image of researchers parachuting in, as he would say, into communities in oppressed areas and doing their studies, gathering their data, and then hitting the road, and going on and making their reputations from the data that they took out of the place. That would be a cultural invasion model. So in that model, the actors draw their thematic content and their action from their own values and their ideology. Their starting point is their own world, and from there they enter the world they invade. As opposed to cultural synthesis. In cultural synthesis, the actors come from another world, but they do not come as invaders. They don't come to teach or to transmit or to give, which is all sort of a one-way direction. But they're rather there to learn with the people about the people's world. Okay, so it's a collaborative process with the people at the center. In cultural invasion, the actors sometimes more and more do not even have to go to the place. They can do a lot of their work through electronic communication, and they superimpose themselves on the people that they're invading. The people then become just spectators or objects of investigation. In cultural synthesis, the actors become integrated. The actors, the community members, become integrated with, the actors being the researchers, become integrated with the people in the community. The people become the co-authors of the action that they both perform on the world around them. And so finally, in cultural invasion, the spectators and the reality to be preserved, whatever you're studying, become objects of the researcher's actions. Where in cultural synthesis, there are no spectators. The object of the actor's action is the reality to be transformed. So this is very transformative. The idea is to make a difference in, as Freire said, this is a quote from Freire, the liberation of men. Sort of a time-bound use of the phrase there. So the assumptions here in the Southern tradition are,
And I'll go second.
okay, so.
Should we introduce ourselves? I don't know if everybody, people probably know who you are, but.
No, come on up. So thank you for this opportunity today. This is terrific. I'm Richard Morgan. We know each other.
And I'm Amy Hammock. I teach in the program in public health, and I'm a faculty member in preventive medicine, the Department of Public Medicine.
I should say I'm in the School of Social Welfare. And today we're just going to go over some of the basics of community-based participatory research. That's what CBPR stands for. I always have trouble getting that out. Just since the reason for doing this here is because it's kind of intended to be the foundation of our Center for Community Engagement. When this was originally put together, we talked about it being a community-based participatory research type of process, or that's what we want to follow. So we thought we would start off by talking about what CBPR is and giving an overview. So here's some of the issues we're going to talk about, but not to spend too much time on that. Community-based participatory research is still probably a relatively new phenomenon in the world of research. Its history kind of has a split between what's called the northern tradition and the southern tradition. The north being usually thought of as the United States and Canada and Europe. Some people throw Australia in there, though it breaks the north-south paradigm a bit. The global south, the southern tradition, thinking more of South America, Asia, and Latin America. Together they have created this history of community-based participatory research over the last 50 or 60 years. Perhaps we'll get to some of that as we go on. So let's talk about the northern tradition, which probably emerged first. It kind of goes back to various theorists. It tends to focus on changing systems through collaboration in research between scientists and practitioners, meaning people out in the field, wherever that field happens to be. People who are on the streets, who know the situation in practice or in a community, say, something to that effect. One of the leading theorists that kind of everybody looks back to is Kurt Lewin, who was a psychologist, industrial psychologist, he's often described as. He was concerned to try to get past just kind of the standard paradigm of a positivist approach to doing research, of going out and just measuring that objective world out there. He said it's very important for us to key into the idea that the human world is really made up of meaning, and people, if we want to get to know what's going on in the human world, we have to look at how people attach meaning to their world and construct their world around that. Talcott Parsons, a sociologist, was also doing the same kind of work and talked about action research, the need to come up with a way of doing research that will have immediate implications in the places that would benefit from the research. So Lewin rejected that positive belief that researchers study an objective world and that the world was separate from the meanings that the participants placed there. So it's important to get at the meaning level. So you might, if you've looked at some of this before, you'll hear some of the kind of interpretivist points of view for research, social constructivism it's sometimes called, symbolic interactionism, all of these different areas, as well as critical paradigms for research. Action research was developed in the vein of work being applied to businesses and organizations. That's often where Lewin is remembered, actually, in that whole kind of industrial psychology area. And so it was, the idea, the model that they formed was working with groups to do self-studies and to change behavior based on the results of those self-studies, and then to follow up with program evaluation to see how the changes were working out. This did have something of an industrial flavor.